last time when I work in the retail pharmacy, so it's like, do you have plan B?
Really?
Yeah.
But cannot give, right?
Cannot.
That's why I'm in business.
Hello everyone, my name is Mary and I'm from Medical Channel Asia. I'll be your host for today. And today I have with me Dr. Genevieve Quek from Clinic 10. Hello!
Hi, Marie.
Yeah, you want to introduce yourself?
Okay, so I'm Genevieve Quek and I run a practice in Pasir Ris and it's called Clinic 10.
So I've heard you have a special interest in women's health. What exactly is women's health and what's so interesting about it?
Okay, so why I decided to have an interest in this and to promote this more is that I hear from a lot of my female patients as well as girlfriends that it's very hard to find a doctor in Singapore that they feel comfortable speaking to, and the doctor also sometimes may not know the range of birth control or offerings of women's health that's available.
We're very excited to have Dr. Genevieve Quek to answer a few series of our burning questions that we have all about women's health. And also for all the men too, who are worried about all the inner workings of us women here today. Hope you stick with us till the very end so you can learn all that we can offer you. And do not hesitate to drop a comment wherever you are if you still have any unanswered questions at the end of the video. So we will be very happy to get Dr. Jen to fill you in. Before we get started on all the nitty-gritty questions, we have a very curious question from a very curious fan. So the question is, do women shave before they see you or before they go for any gynecological checkups?
Okay, so many patients are very concerned about this. I mean, honestly, it doesn't affect the physical examination in any way. So as long as you feel comfortable, that works for us.
It's never cute, but it needs to be said. So most women will have at least one episode of vaginitis in their lifetime. Vaginitis involves inflammation of the vagina, leading to uncomfortable symptoms like pain, itching, and burning. So I've even heard that it's the most common gynecological problem that you see in a doctor's practice. So what is your take on this?
Okay, so yeast infection, bacterial vaginosis, they are all very, very common symptoms that everyone experiences. It's not dangerous, it can be easily treated. So whenever you do feel any of these symptoms, please get yourself checked out as soon as you can and don't try to hide it or try to treat it yourself, because sometimes that may worsen things as well.
So you've brought up so many different conditions. You've said yeast infection and bacterial vaginosis. Let's break this down one by one. What is a yeast infection?
Okay, so a yeast infection is due to an overgrowth of yeast in our body.
And how can we treat that?
So there are a few treatment methods for yeast infection. There's topical, something to apply, pessary, which is something to insert, and oral, which is something that you take.
So I've heard that some people complain of recurrent yeast infections. It comes over and over again. How can we prevent that?
Okay, prevention has many methods as well. So firstly, probiotics does help. Maintaining good hygiene, so I always recommend that after exercise or any vigorous activities, or if you're sweaty, do try to change and shower immediately. Of course, if it is really recurrent despite all these methods, there's always oral medications that you can take regularly.
I've also heard that some people say that contraceptive use is associated with yeast infection. What's your take on that?
I don't think that's true. Yeah, I think it could be a coincidence, but there doesn't seem to be any correlation between birth control and yeast infection.
So maybe for a question that a lot of people in the audience may be too shy to ask, if you have an yeast infection, can you still have sex with your partner?
Okay, I generally recommend that if you have any infections of any kind, that we treat it first, and once the symptoms are better, then resume sexual activities. It is not to say that yeast infection cannot be transmitted to men, even though it's not classified as a STD.
So now we've got a great summary on a vaginal yeast infection. So let's talk about bacterial vaginosis. It's quite a bit of a mouthful. Let's just call it BV.
Okay.
So what is it and how does it differ from a yeast infection?
Okay, so BV is essentially a bacterial infection. It's an overgrowth of anaerobic bacteria. And most people get it from having multiple sexual partners, so it is an STD.
Oh, so I didn't know that BV was actually considered a STD.
Yes, it's considered STD by CDC. The men generally don't get much symptoms, sometimes no symptoms at all, but some people do like to treat their partners as well.
So I've actually got a few fan-submitted questions here that I find particularly relevant, so I'm curious about them also. So this fan had asked, when I Google online, there's a lot of advice about boric acid suppositories or pessaries to treat BV. Does it work or where do I get it? Can't seem to find it in Singapore.
Yes, we don't have it in Singapore. So usually we use oral medications or pessaries as well. I generally prefer oral for BV. Doesn't irritate the skin too much, and we know exactly how much is being absorbed.
However, all these symptoms all sound quite alike, like irritation, pain, itching, burning. So it will really be quite a shock to wake up and realize that, hey, I've got this and I don't know why it is. And what if it's an STD, like maybe not BV, the other STDs that we have? So what are some of the common STDs that can occur, and how do you differentiate between all of them?
Okay, so generally yeast tends to be itchy with clumpy discharge. Okay, you don't get much pain, you don't get all the urinary tract symptoms. Same for BV, you tend to have a fishy odor, discharge. Okay, likewise, not so much irritation to the urinary tract. Sometimes you may get it, but mainly the fishy odor. As for the STDs like chlamydia, gonorrhea, as well as herpes, the symptoms tend to be a bit more, especially for gonorrhea. You tend to have more yellowish, greenish discharge, and sometimes you may have irritation to the urinary tract. So when you pass urine, you may get a little bit of pain. For herpes, you tend to get very painful blisters. So that's definitely very telltale of all the STDs.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.